So welcome everybody. We are here to talk about everything you need to know about our health benefits plan. So in this 1 hour session, we're going to cover why our health coverage is essential for entrepreneurs and self-employed business owners, how Health Connections makes high quality coverage accessible, what's included in the plan. I have some special guests here that I'm going to introduce. They're going to talk about all the benefits like prescriptions, dental, vision, travel coverage, life insurance, and more. And we're going to talk about why CanWCC developed this program and created it to be affordable and tax deductible. So I'm really looking forward to this session with all of you. So let's get started. My name is Jenna Clockley, and I am the Director of Membership and Community here at the Canadian Women's Chamber of Commerce. And I'm joining you today from the lands of the Anishinaabe, the Cree, the Ojai Cree, the Dakota, and the Dene peoples, and home to the Métis Nation covered in Treaty 1, colonially known as Winnipeg, Manitoba. And CanWCC recognizes that its work and the work of many of our members take place on traditional territories across the country. We acknowledge that there are almost 100 treaty agreements that cover the territory now called Canada, and we are thankful to be able to work and live in these territories. We are thankful to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of Canada and to all communities. CanWCC acknowledges that its office is located in Toronto and on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. So September is National Day for Truth and Reconciliation. Our offices are closed on that day. And if you are looking for something to dive into, I highly recommend this book. I did talk about it at networking this week or last week. And it is a really great book by Angela Sturrett. And she actually lists out all the records of missing and murdered Indigenous women going back to the early 1960s. And this is really focused on the Vancouver area and Prince Rupert area, and talks about why this crisis happened, like what was in the way, why didn't we make changes earlier, and what simple changes that could have been made would have made a difference. And it's Angela's personal story as well. So this is a great read. I highly recommend it. And you can get it at any bookstore. Okay. So for those of you that don't know about the Canadian Women's Chamber of Commerce, we are the first and only Chamber of Commerce for diverse, women-identified, and gender-diverse business owners in Canada. And as a Chamber of Commerce, we represent your needs with the government, and our title as a chamber give us access to the people who impact change. We are here to amplify the stories and the voices of women and gender-diverse, self-employed, and small business owners, and to fight for their economic equity. So let me introduce today's guests. Nancy Wilson is the founder and CEO of the Canadian Women's Chamber of Commerce, which is the first and only chamber of commerce advocating for the over 1.2 million women and gender diverse business owners in Canada. Nancy is a chartered professional accountant with 2 decades of experience across startups, multinationals, and not-for-profits. And Nancy also founded an accounting firm focused on women entrepreneurs. She is named one of the 50 Changemakers of the Year in 2023 by the Globe and Mail. And Nancy is a passionate feminist determined to create systemic change. Ken Doody began his career in the life and health insurance industry shortly after graduating from York University, where he had originally planned to pursue a career in teaching history. And over the past 4 decades, he has held leadership roles in management, training, and mentoring, while also developing sales training programs, delivering keynote presentations across North America, and contributing to respected industry publications. In 2005, he founded Kenneth L. Doody and Associates, helping to families and business owners to safeguard what matters most to them. Emanuela Messina entered the insurance industry at just 19, quickly obtaining her life license and taking on the management of a group benefits department. Fueled by an entrepreneurial drive, she launched her own business and has since built a successful career as both a life agent and an entrepreneur. And throughout her journey, she has been guided and inspired by the mentorship of trusted leaders in the industry. So welcome to each of you. Emanuela and Ken are going to talk more about the program that we have. But first, I'm going to turn it over to Nancy Wilson so she can share a little bit about the vision for this program and, really the importance of it. So welcome, Nancy.
Thank you, Jenna. I'm really excited to be here with all of you. Health insurance and life insurance, for that matter, is something that I've heard from members since the very beginning that they're interested in, and I feel that 100%. Not to get too personal and TMI, but I have I have a lot of prescription costs, and I have had a lot of prescription costs for many years now. So having personal health insurance to subsidize those costs has been an important and consideration for myself and my family for many, many years, a couple decades now. So it's something that I know as an entrepreneur, and even when I was employed in the corporate world, those jobs didn't always come with health insurance as a benefit. So it's something that you have to weigh the costs of the premiums against the benefits you're going to get. But it's also so important, particularly if you're the breadwinner, to look at important things like critical illness, all of these things. Anyways, I'm already getting into the weeds here, and I'm not the expert, but it was really important for me right from the beginning to try to bring an affordable option to our members. And I've known Ken Doody since the very beginning. He's been a passionate and stalwart, I'll say, supporter of CanWCC since the beginning. And so I'm really, really happy that we have this program now in effect. And I'm a customer, so there you go.
Thank you, Nancy. So I'll throw it over to Ken and Emanuela, and I think they have a presentation for you, and they'll be able to answer any questions you might have. So if you've been thinking about something or thinking about participating in this program, and there's been something that you just wanted to question first, please feel free to use the chat or the Q&A box. And over to both of you.
Thank you very much, Jenna. And thank you both for allowing us to have this time with the group today. I'm just waiting for the presentation to come up on the screen, and then I'll get rolling. So I'd like to start with a couple of statistics. In June 2024, Statistics Canada released results of a study that was conducted in the fourth quarter of 2023. Findings were very interesting and surprising, I'm sure, to a lot of people, where more than 7 out of 10, that would be 71.3% of self-employed workers, operated small businesses with no employees. Those are staggering numbers, actually. And among those with employees, just over 2/3, or 68.7%, had 5 or fewer. So nearly half, 46.2%, of self-employed workers ran unincorporated businesses. So that gives you a feel for the workplace in Canada and what sort of businesses are driving the economy of this country. So in the summer of 2024, the idea for Health Connection was born with a vision to develop group benefits specifically focused for the underserved small business market, specifically for companies that are not incorporated and run by a sole proprietor. By October of 2024, we introduced our initial plan designs to Green Shield Canada. And they understood our vision and further supported this initiative and helped us bring this to fruition. We are truly grateful for the opportunity to build this product and for the chance to make a meaningful impact in the Canadian health and dental marketplace. In January of this year, just 3 months after the development began, we proudly presented our finished product to the Canadian Women's Chamber of Commerce. And Nancy and her team immediately realized the value of this, and Health Connection is now available to the members of the Canadian Women's Chamber of Commerce. The first policy, in fact, was put in force on March the 1st, 2025. And that's only 5 months after Emanuela and myself first introduced the concept to Green Shield Canada. Our mission as a company is to support self-employed individuals and small business owners across Canada.
So what is included in Health Connections? Well, this plan is for self-employed individuals who can finally access a comprehensive group benefits plan similar to those who have businesses for 5 or more employees at an affordable rate. And what we have put together are 3 levels of coverage. We have a 70% plan, 80% plan, and 90% plan. And all of these plans have the same core benefits with varying reimbursement levels depending on the option that you select for your lifestyle. Now, I want to talk about status. And when we talk about status, I want you to focus on the number of people rather than marital status. So, for example, a single person is a member only who has no dependents. We have couple rates, which means we have a member plus 1 dependent. And this could be a heterosexual or same-sex couple. This also applies to single parents with 1 dependent child. Now, for family status, we are looking at members of 2 or more dependents. So focus on the number of people rather than marital status when you're looking at where do you fit in this category. We do have 2 sets of rates, and they are based on individuals who are 69 and under, and for those who are 70 to 85 years old. Now, every plan has a full health, dental, and travel coverage, which actually would give you coverage to age 85, and when you hit your 85th birthday, that's when the policy would end. Now, let's talk about some of the benefits that are included in our Health Connection plan. So our plans have life insurance and accidental death and dismemberment insurance. This also includes those who have dependent coverage. So if you're in the couple or family category, they have some of that benefit as well. And that would expire at age 70. It was important for Ken and I to also include critical illness into this policy. And we also wanted to extend this to the dependents as well. So they do have some coverage for that. And also this policy would cease at 8, or that portion of the plan would cease at age 70. And we have employee assistance program that is available to age 75. Now, if we're going to jump into the extended health portion, that's where your prescription medication would take in effect. Our plan covers mandatory generic brands, and it is for $5,000 annually per person. So if you have a dependent or you have more dependents, that $5,000 would be for each person. Okay, it's not a combined total amount. We also included things like registered massage therapy, chiropractor, acupuncture, physiotherapist. There's a whole list of practitioners that we've included in our plan. And depending on the level of coverage that you select, this would also vary on the coverage level that you would receive. So 70, 80, and 90% plans have different various levels in there that you would notice on the plan on the screen at this moment. The other thing we wanted to include is vision care. Most people have glasses, and we wanted to make sure that we address this in our plan. And every plan across the board has eye exams for reasonable and customary amounts, okay? So regardless of which plan you choose, you can get an eye exam every 24 months to get your eyes checked. Now, the 80% and 90% plan do have coverage for eyewear, such as your glasses and contact lenses, okay? And one thing that was really important to Ken and I in this area is the travel portion. And that it means that we wanted to have a plan that's just not your typical plan that you would not receive somewhere else. And we feel that this is the best that's out of the market. And what do I mean by that? Well, it's $5,000 covered per covered person per incident. Sorry, $5 million per covered person per incident. We cover up to 90 days. okay, per person. And our plans include trip interruption, cancellation, and baggage coverage. You wouldn't typically see this in the marketplace for group benefits, but this was a must-have for our plan, and we've gotten a lot of great feedback on it just for that part alone, especially if you're a traveler or a snowbird. It's a huge thing for most people. So as regards to our travel, we don't ask any medical questions up to age 85, and you don't need to let us know when you're traveling. I do recommend that you just call them just to familiarize yourself with the policy before you leave, but that's completely optional. And one thing we do want to note, and this is standard across the board, is that there is a 90-day pre-existing conditions clause that does apply. If you have more questions about that, we can address them at the end, or we can take those offline if you'd like. So our plan covers things in the nature of medical services and supplies. These are things that are your custom-made foot orthotics or orthopedic footwear, CPAP machines, diabetic supplies, things like daily living aids such as hospital beds, IV stands, patient lifts, also things like mobile aids such as canes, crutches, walkers, and wheelchairs. In this specific part of the plan, it's a very long list of items. So if there is something specific that you'd like to be aware of or know if it's a covered expense, we can definitely answer those questions for you either here or offline. And all of our plans do come with dental coverage, and all of the plans come with your basic and comprehensive coverage. Our 80% and 90% do include some major care as well. And for those individuals who have children who are in the midst of getting orthodontics or braces or will be getting them in the very near future, our 90% plan does cover orthodontic coverage as long as the treatment has started prior to their 19th birthday.
So how does this work? Well, the enrollment is quite quick and easy. We have rewritable PDFs that are available to people who want to join the plan. And we're currently working on a online enrollment program, which will make things even more convenient. The Canadian Women's Chamber of Commerce is plan sponsor of the plan. And so that makes Health Connection available exclusively to members of the CanWCC through a special arrangement that we have with your association. You might be wondering if the plan is only for women, and the answer to that is no. And just recently, what Nancy and the team put together was a CommunityPLUS membership. You're probably all going to be familiar with the business membership, but the CommunityPLUS membership opens the membership to men. So personally, I'm a CommunityPLUS member because that enabled me to buy my own plan, which is kind of cool. It's kind of difficult when you create a plan and you're not eligible for it yourself. So anyway, whether you're a woman, a non-binary, or a man, you can enroll in a CommunityPLUS member, and in 5 minutes or less, they have a very convenient link, and it's so fast and so easy. And it's nice to know that registering for the association will not delay you getting any benefits on your plan. And I want to reiterate that there are no waiting periods for any of the benefits on the plan. Once you're on board, you can use anything. You can go to the pharmacy, you can go to the dentist, take a trip, whatever you need to on the first day that you have your plan.
And since we've launched Health Connection in March of 2025, we've received really great feedback from many of our members. And I'd like to share a quick testimonial from Christine, who is incorporated, but she is a one-person operation. And she wrote to Ken and I and said, I completed my first claim submission without receiving my card. However, I was able to complete my first claim easily and quickly online. The process was smooth and the app was very user-friendly for a first-time Green Shield Canada user. Having a health benefit plan in place that fits my lifestyle needs is one thing, but having the claims experience be easy, quick, and quickly confirmed my choice to have my plan with Health Connection. So our plan is really designed for corporations and sole proprietors, and it specifically serves the under 3 member employee market. So our plan provides access to a traditional health plan for the underserved self-employed individuals across Canada. And we combine flexibility, ease of use, and a lifestyle alignment with trusted coverage. And we're continuing to grow our membership steadily, and we're excited to show you how Health Connection can fit your lifestyle and your business needs.
So at this point, we'll soon be opening up to some questions, and we thought that we would just take a moment and take a few frequently asked questions, because I'm sure these will come up, and hopefully they will spur some thought in everyone's minds as well. So first of all, a question that we get a lot is, are there tax advantages to having a health plan? Nancy touched on this a little bit earlier. And yes, there are tax advantages, as the premium can be tax deductible for sole proprietors, partnerships, and corporations, while the benefits that the members of the plan receive are received tax-free. Some people want to know if there's a health spending account available within the plan. And the answer to that is yes. We do offer health spending accounts as part of Health Connection. But if someone does not want to have a Health Connection, we can also do a standalone option for them. And people often say, well, when will my benefits begin? Because many of the things that are out there, many of the plans that are out there for 1 and 2 people operations, you can't get any drugs for 6 months, or you can't get any dental for a year, etc. Well, everything starts on day 1. As I mentioned earlier, the plans always start on the 1st of the month. And on the 1st of the month, you can go to the pharmacy, you can go to the dentist, you can go and do whatever it is that you need to do without worrying that it's not looked after. And just touching back on Christine's comments that she wrote to us, is she joined the plan only a few days before the end of the month. And of course, it takes a little bit of time to set things up. That's why she didn't have her card yet. But her benefits were in place, and once she received her card, she went online and she was able to deal with them quite easily. So that concludes our presentation, and we are welcoming any questions that you have.
We've got a couple questions in the chat. One of them is the cost influenced by medical history and current illness?
That's such an excellent question. Do you mind if I take that one in?
Go ahead.
Okay, because the Canadian Women's Chamber of Commerce is the plan sponsor, what happens is what you do individually as far as claims are concerned does not affect your premiums, because it's the entire group which is taken into consideration on here. And where you will see the most effect on your premiums is going to be as the demographic of the group gets older or changes in some way. You may take on a bunch of 22-year-olds next year, and all of a sudden your ages start going down. You could conceivably have a slight decrease in premium. So it's not taken that you're always going to have an increase in your premium. You could be pretty much the same, or it could increase a little. Our goal as an organization is never to hit double-digit increases as a whole for the group.
Okay, great. I've got another one here. There's a business who's here. They already have a benefits plan through their Chamber of Commerce, but they're really looking for benefits that are geared towards women's health and wellness specifically. They're having a hard time finding affordable options for women's health and wellness. Probably things like menopause and breast cancer, and dealing with those issues that women deal with. So parts of that are included in this plan, or where can they use those or find funds for those kinds of things?
So there's a couple ways you can actually look at this. The first one is if they are on certain medications, which is a factor when they're dealing with an illness, we could actually go in and check to see if that prescription that they're presently on is a covered expense on our plan, yes or no. And I've actually had a few people who've asked me questions about cancer treatments, menopause, a few things like that. And I've checked several of their drug identification numbers, and they were covered under our plan. So there is a high probability that it would be covered. But when we sit with the client or with the member or talk to you, we will dive deep a little bit more and see what your needs are to make sure that if you're going to move from one to another, do we have it coverage and does it make sense, and what does the transition period look like? With certain people that are dealing with cancer, for example, and they need a wig and stuff like that, that's where our medical services and the supplies section of the health extended care portion comes into play. So there are certain things in there, and that list of items that could potentially help them with those types of things as well. So there are a few ways that we can navigate this, or if there are specific things that just are not covered, whether it's under their current chamber plan or ours, that's where the health spending account portion could make sense for them to say, it cost me $1,000 personally, my own personal dollars to do this. I'm going to put it through my spending account and have the business pay for it and then not use personal dollars. So there's a few ways that we can massage this. It's just depending on what the person's needs are. And once we get that information, we can really put a better plan in place and see how we can make it make sense for them in their lifestyle. So it's kind of an over high level answer, but there are ways that we can look at navigating it if that's something that they need for their specific illness that they're working through, or lifestyle that they're experiencing. Yeah.
Additionally, when we look at the medical practitioners, we also have $500 per year per person for psychologists, psychotherapists, and medical sorry, I've forgotten their name now. The counselors, medical counselors as well. And also on our telemedicine, you'll notice that it's up on the screen now, that it's unlimited confidential health consultations 24/7, 365. And so members and their dependents can also call there and get treatment, prescriptions, lab work, and specialist referrals. So there are other areas which also will deal with specific situations that people encounter, whether that be the ones we're discussing now or whether that be other ones. That telemedicine program is an excellent, excellent program. I know other companies which will have a 12-hour limitation on this. And it's great as an introduction, and it's better than not having anything. However, you may need 50 hours when you call into something like this, and the telemedicine is unlimited. So that's another way we can help people deal with their with some issues they may have.
Okay, Ivana, do you want to ask a question? We have a short period of time, so
Sure.
dive in.
Yes, I was the one who actually asked about the women's health specific benefits, and what we're actually kind of looking for is something that's more than just the basic, because this plan, to be honest, is pretty much mirroring exactly what we already have through the other chamber. What we're kind of looking for is things like, fertility. So not just like the general kind of basic menopause stuff, like it goes beyond that. I know that it exists out there. It's just very difficult to find. There's even options, for example, to have daycare or something included as part of like a lifestyle and wellness, because it allows women who need to either deal with medical treatment or actually just work to actually include that also as part of their benefits. So that's kind of what I think we're looking for. So if you have any resources, I'd really appreciate that.
Yeah, sometimes fertility treatment would be covered on specific plans. It just depends on the person. We did not add it here, but those ones are also very limited as well. So, IVF costs what, $15,000 now, something like that. Your coverage amount could be only $2,000. So if you're looking at something to bridge a specific gap in the fertility area, it's going to be a little bit difficult to find it through a traditional health plan. But I think it still goes back to stemming from the health spending account and seeing if that's a better fit for you, right? So when you're using a spending account, it has to make sense to your lifestyle. And the reason why we would say that is because if you ever get audited by CRA, we want to make sure that what you're using is what you need, right? You don't want to overuse and get your hand slapped later. And I think this is where the dialogue of going back to the person or to yourself and understanding what your needs are and see if we can bridge that gap somehow. So our plan does not cover fertility. As far as daycare is concerned, that's a wellness thing that you would find in a spending account. Some organizations will allow that. But the thing that you need to realize with that is that you can get the daycare covered, but you're still going to get taxed on it at the end of the year. So it's just understanding what your needs are. So if Ivana, if you want to have a conversation further after this, please feel free to reach out to Ken and I, and we can see how we can help you, and see if there's a way to bridge the gap that you're looking for you and your staff.
Okay. Someone asked, is there a way to opt into more life insurance greater than 25K?
So great question. I would say you're better off looking at an additional private plan on top of what you have through your group plan, only because your needs might be more than 25,000, right? So as agents, Ken and I have the ability to sit down with you and figure out what your needs are and put a plan in place that goes above and beyond what the group plan would give you. So we do a financial needs analysis. It's basically a blueprint of where you are financially and what you need coverage for. And based on what your needs are, we can give you a plan that's separate from this. So purchasing additional coverage on this plan is not available yet, but I still encourage that people get something separately on top of what their group plan offers.
Yeah, and both Ken and Emanuela are who you talk to when you're setting up this plan.
Yes.
So when you get into Circle and you're in the Health Connection benefits area of Circle, their contact information is there. You have a conversation with them. You set up this plan. You figure out whatever else you need. So they work with you to make sure that it serves your needs and it has everything that you need access to. The reason that we have the CommunityPLUS payment is because you do need to be in our group in order to access these benefits. So
Correct.
that's why there's the membership. You can access it through your business membership benefits or through joining the CommunityPLUS program if you're not ready to become a CanWCC member yet. So I have some more questions in here. One is asking, what's the definition of dependence again? Some people have adult children. They just want to know, what is that definition?
Yep. Ken, you want to take that one?
Your dependent is a very simple definition. You think about a spouse and a child. They would be your dependents. The dependence does not go the other way. We can't put grandparents, for example, on there. Okay. And the definition of a dependent child would be under the age of 21 and single. Now, that can be expanded if your child is going to an accredited, university, community college, trade school, et cetera. If they're still in school up until age 25 and are still single, that would be the definition. And of course, spouses would be there, whether that be same sex or whether that be heterosexual.
Okay, perfect. We have another question. Would naturopathy be included in this plan?
Yes.
Yes.
Naturopath is on the plan.
Perfect.
Naturopath and osteopath.
Okay, and then I think you have a second slide here that has age 70 and up, right? Do you want to just pop to that slide so people can see that, because some people are considering it that are not in this age group. And another person's asking, what's the reimbursement process for the different services? Is it direct bill or pay and submit receipts?
Both.
So that's a good question. It depends. So what I'll give you a scenario. If you're going to a pharmacy or a dentist, most of them are already set up for direct payment. So once you go and see your pharmacy or dentist and you give them your card, they'll have it in the system. And what happens is the dental office or pharmacy will first bill the insurance company, and then you would pay whatever the difference is, the 30%, 20%, or 10%. So that's how direct billing works there. Some vision care centers do have the ability to do direct payment as well, and you would just pay the difference. It just depends on on the location. Not all of them are equipped there. I would say 35–40% are, and I think it's going to continue to grow when you're looking at getting some glasses done. When it comes to practitioners like your massage therapist, chiropractor, osteopath, that type of stuff, they are not set up for direct billing. Okay, so what happens there is you would pay for the service and then you would go into your app and and the process is very simple and user friendly. You submit all the information that you have on that you see on your receipt, and then you press submit, and then within typically, I'd say 2 to 7 days, business days, you will get the money back into your account if you put your banking information in there. Green Shield is actually very good at reimbursing people quicker. I've seen people get it the next day or within 1 to 3 days. We just say 7 days because it depends on when the bank lets it have it into your account. But the minute you submit an online manual claim and you have your banking information in there, the process to get it right back into your account is within a day or two, typically. Yeah.
Okay, someone's wondering if you can explain the EAP and telemedicine benefits. You kind of touched on a lot of what can happen on telehealth. It's very robust. So is there anything else you want to add to that for the EAP and the telemedicine?
Well, the EAP is designed to assist both the employee, in this case, it would be the employer and their dependents. So by having unlimited confidential consultations, these are done on the phone, and it really doesn't matter what the topic is that you want to discuss. It could be someone who's in distress and contemplating taking some pills. It could be someone who has a child. As we saw a lot of this after COVID was over and children were getting back to school and they were having difficulties adjusting. We saw a lot of people take advantage of this type of counseling in that, for that type of reason as well. Um, the Employee Independent Assistant Program, it really is designed as something to more for an emergency, but it can be an ongoing treatment that people are having, and that's where the specialist referrals portion of this comes in, because they can be uh, um, sent over to a specialist if it's something that really needs a little more in-depth work than this. I don't know if that answers the question or not, but
And it covers things too, like if people are going through bereavement, addiction, stress, things happening at home, things happening at work. Think of mental health and how that has become a big thing for most people, and they need that outlet of, okay, I got this issue, I don't know where to go, who to talk to. I don't even know what to start, where the process is, or I don't even know what's going on with me, but I know something is that I need to talk to somebody. That's where the telemedicine would kick in and help them through that process. And then if they need to be referred to another physician to help them with whatever area it is, they've got that ability to do that. So it's a big thing that people really need nowadays, and that was a for sure thing that we had to have in our plan. So if you need anything or a dependent needs something in that area, that's where telemedicine would kick in.
and while the people who are on the phones in the telemedicine, many of them can treat you, or most of them, I should say, can treat you in pretty much anything. But if you're looking for somebody whose specialty, for example, is psychotherapy, they can refer you to someone who that is their specialty as well, and you can develop a relationship with them as well.
Someone wanted clarification on Emanuela's comment about a 90-day wait period and the idea that you can start using your benefits right away.
So the 90-day was the travel, which is the pre-existing condition. So let's go back to square one. If it's a health, like prescription medication, vision care, you need to go to the chiropractor, dental service, that type of thing, your policy would kick in day one. Okay, so there's no waiting period on that. When you go specifically to the area of travel, there's a 90-day pre-existing condition, which means that if a person has an ailment that they're working through, if there's no change prior to the 90 days of them traveling outside of Canada, and I'm talking about prescription medication, change in medication, anything like that. If a person travels and they've done one of those things where the prescriptions change, even the milligrams or the type has changed, and something happens while they're away, that could prevent them from getting coverage if they are dealing with that issue while they're traveling. If it's anything else unrelated and they're traveling, that's not an issue. But it's more of if you have something that's going on prior, you want to make sure that you're pretty much a clean bill of health, that there's no medical changes, or even too that if you're waiting on test results or you have to do a pending exam or blood work, and while you're going away, that also could prevent that specific thing being covered while you're traveling. So it's not a gray area, but we want to make it known because people are under the assumption, well, I have travel coverage, I'm good even if I have this hard thing that I'm working through. Not necessarily. And that 90-day pre-existing condition clause is not just part of our plan, it's part of every single plan, every single travel policy that's out there, even the ones that you have on your credit card, believe it or not. So if you're in that area that you do travel a lot and you have something going on, let's have a discussion about it and let's be clear of what it is. And then we can make sure that it makes sense for you. And if you have to get anything additional, we could help you with that as well. But the 90 days is a standard thing across the board for all travel policies. So I hope that answers the question.
Yeah, that's what they wanted. They just heard the two
Awesome.
things, a day one access and then 90 days, and they were just wondering the clarification. So
Perfect.
that's great.
Amazing.
So if someone has a spouse who has a primary basic plan with like a retirement plan with another organization, would there be any issues using these plans together?
No.
No.
So you can actually have both plans work simultaneously. So one policy would be the first benefit payer, and then let's say the health connection would be the second one, and it would overlap anything that would be outstanding on the first policy. So quick math, if it's an 80% plan on plan A, and it's $100, the insurance company would pay the $80. You would eventually be having to pay that $20. But because you have plan two, which is, let's say, health connection, you can take that $20 and put it onto our plan. So they can work simultaneously and overlap.
Perfect.
And generally, the pharmacy will deal with that on your behalf, as long as,
And the dental.
of course, you register with them, both plans.
Yeah. And dental offices as well. As long as they
Yes.
have both, they will complement each other at claim time.
That's great. And what if you have a dependent child who is disabled? Could they be covered for longer, or would they be covered for longer?
Yes, they can be. When you have a disabled child, the age 21, age 25 situation does not come into play. They will stay on the plan as long as you have the plan.
Yeah. We would just need to let the insurance company know that, and there would be some paperwork, just so they have it on file, so that when their birthday turns 26, for example, when they're technically supposed to be off, they won't have any gap in coverage. It'll just be simultaneous.
Well, that's all the questions we have, and you really answered them so well. So thank you so much. We had a lot in the chat. I was going through and finding all of them. So thank you so much for that and this presentation. Thank you both for being here. And the good news is when you get into either our annual business membership or our business membership or our Community Plus membership, you get access to both Emanuela and Ken. Their contact info is in there. You reach out to them to get on the right plan. They'll have a conversation with you. They'll help you figure out which levels you want and what you need. So you can take advantage of these health benefits that work for you and your business. And that's all available in Circle. So if you're already a member, you'll find those details under the health benefits connections. It's in the circle space. You can go and read the information there, and then you can reach out to them. And I just want to thank you both for your time. Is there anything else you want to add, Nancy, or anything that we didn't cover?
The only thing that I didn't hear, and I could have been answering someone's question, was I think someone asked, is it possible to switch between the plans? Or I think the other part of the question was, once you sign up, is it like a 12-month commitment?
Well, first of all, there's not a limit as far as if someone, for example, wants to leave the plan, they would just need to provide the company with 30-day notice that they want out of the plan.
Mm-hmm.
Secondly, we like to keep people in a plan that they choose for a 2-year period
Mm-hmm.
before we make a change. However, when someone has a life change in a situation, such as a marriage, a divorce, birth of a child, these types of things, they may want to move a plan because their requirements either increase or decrease. At such a time, we will do that without worrying about the 2-year period.
Got it. Okay. Thanks so much. Ken, you've been, you've been on my side, on the health insurance side for years now. So it's a pleasure to work with you, and Emanuela, you as well. And thanks to everyone who spent the last hour talking about this. I hope for everyone that thinks this is a good fit for them, I really encourage you to look into it. And for those of whom that take advantage of it, I hope you're as happy as I am.
Yeah, and just thank you everyone for attending today. Like, clearly we needed this explanation. So it was so great to be like live and in person and ask one-on-one questions and just get them answered right away, because insurance can be confusing, right? So if you're interested in this, if you're not yet an annual business member or a business member, I keep saying annual, but we have several different types of plans. If you're not yet a business member or part of our Community Plus, we invite you to join us today to take advantage of those benefits. Our annual membership starts at $99. We also have our lifetime membership, which is $990, a one-time payment, and you're in for the rest of your life. And I just can't thank you all enough for being here and engaging and asking all these really important questions, because it really helped us explain this program. So